I can't, yeah, I can't hear anybody.
If we will, yeah, just finish the agenda and then we'll do another roll call because.
Jay, I can't hear what they're saying.
All right, apparently gremlins are here. Can you hear him now, Kristen?
No.
Oh wait, usually you can't hear it.
Okay, clearly Jason did me something again.
Council members, the Granicus computer that Nathan's at doesn't come through clearly on the Zoom.
Okay.
The public can hear it, but we're going to help you guys along with it.
Thank you.
Anna Maria, program manager on the city and agenda item 8. Go ahead and call the roll again. Councilmember Banks.
Here.
Present. Councilmember Palmer.
Here.
Councilmember Wynn. Present.
Here.
Moreno. Present. Councilmember Bassett. Absent. We have 4 members present. We have a 4.
Thank you. We are meeting virtually due to the COVID-19 pandemic, which requires that we do some things differently. So we are forced to do this, and until we can meet in person again, we have to go through these procedures. We are required to have a period to allow public comment. So I'm going to ask that we actually take a 15-minute recess to allow for public comment, and we'll shut down while that comes in, and then we'll pick up after that. And I do want to ask for one change in the agenda. We do have to, we have a presentation from Dr. Vegno regarding Hispanic Heritage Month, and she has to leave to go deal with some other pressing city business. So I'd like to be able to take that up at 10:30 to allow her to make the presentation so she can get on with the other business. So if there's no objection, we'll amend the agenda to be able to accommodate that, and then stand down for, I'm sorry, make it 20 minutes. That'll put us right at 10:30 to be able to do that. So if no objection, we'll stand down for 20 minutes for public comment. Do I need a motion to do that, or we just down? All right, motion to recess.
So moved.
It was moved by Councilmember Palmer, seconded by the Council Vice President. And all in favor say aye.
Aye.
Any opposed? Okay, we're down for 20 minutes. Thank you.
Hello, is anyone there?
The committee is on a break to receive public comment, and they're supposed to reconvene at 10:30.
All right, Mr. Badon, we're currently on recess to receive public comment until about 10:30.
Oh, okay. What would you like me to do?
If you could just, we can mute your line right now and we'll wait and we'll start back up at 10:30.
Okay, great.
We are back in session, so colleagues, if we could please get a motion to reconvene.
I'll make the motion.
Thank you, Madam Vice President. Second.
Second.
Thank you, Council Member. All in favor, say aye.
Aye. Aye.
We're back in session. So as we previously announced, we're going to alter the agenda to allow Dr. Vegno and Councilmember Moreno to make the presentation relative to Hispanic Heritage and Health Month. So Councilmember Moreno, would you please proceed?
Sure. Thank you so much, Mr. Chairman. Yes, so this is agenda item number, I believe it's number 7. And I appreciate you letting us take this first. So this is a presentation on Hispanic Heritage and Health Month. There are a few people that are going to be part of this panel, including, of course, Dr. Jennifer Vegno, Director of the New Orleans Health Department, Rosine Pema Sanga, Director of International Relations for Office of Mayor Latoya Cantrell as well will be presenting. We had an additional presenter as well, but I know that she's not going to be able to make it. But I do want to mention that Ana Maria Villarruben has just been amazing with the Office of Youth and Families and helping the Hispanic community and really promoting Hispanic Heritage and Health Month. So as the council members know, this past Thursday in our main council meeting, we passed a resolution saying that this month, for Hispanic Heritage Month, we also wanted to promote Hispanic health. So here in New Orleans, we're calling it Hispanic Heritage and Health Month. And the reason for this is because, you know, we really have been seeing a disproportionate impact in our Black and Hispanic communities when it comes to COVID-19, really just devastating impacts in both of those communities. I know that there was a recent article, in fact, Councilmember Banks, that talked about the number of friends who you have lost in the African-American community due to COVID. So we just think it's really important to continue to bring attention to the disparities that exist. Because only by making sure that people know that there's a problem out there can we start to begin to fix the problem. So just to kind of give everybody a little bit of background on this and what's happening in the Hispanic community, I want to take y'all back to, I guess this was roughly late April and May, where we were having our community testing sites. And I have to give huge credit to Dr. Vegno and her team, because they were really just excellent when it came to data collection. And one of the pieces of information that they were collecting is whether someone was of Hispanic ethnicity. And based on that data that was being collected, we were able to see that even though the Hispanic population in the city of New Orleans is roughly around 6%, we were seeing that more than 50% of the positive cases in our community testing sites were Hispanic people. We were also able to see at that time that the rate of positive cases in the Hispanic population was roughly 20%, when for everyone else, it was much lower at around 3%. So then, you know, our numbers were certainly noticed by the White House. And I can tell you that, you know, during a meeting when Dr. Burks was here a few months ago or a couple months ago to meet with the governor, she actually mentioned the fact that they noticed that ping in New Orleans, seeing what was happening in the Hispanic population there and wondering why they weren't seeing at that time, you know, similar numbers around the country. And it turned out it was a data issue. And then of course, now what we're seeing across the country is that this devastating impact on the Hispanic communities across the country is certainly present and being addressed in all parts of the country. So based on all this, I met with the Hispanic Task Force, because we did create a Hispanic Task Force after we saw these numbers related to COVID, as to, you know, what we could do to really advocate precautions and making sure that everyone stayed as healthy as possible in the Hispanic community. So in this Hispanic Task Force, we met and we decided that we didn't want to lose an opportunity here for Hispanic Heritage Month to also promote Hispanic health. So that leads us to where we are today, because we're really pushing on making sure that everyone understands and sees these sobering statistics that are out there related to COVID in the Hispanic community. We want to, of course, continue to urge precautions, including mask wearing and social distancing. But most importantly, we want to shed light to what could be the reason as to why we're seeing these high rates in the Hispanic population. And some of those potential reasons could be because of disproportionate representation in frontline and essential work settings, jobs that do not provide sick or paid leave, and multi-generational housing. And we're also seeing in the Hispanic population, the immigrant population in particular, this fear of reaching out to get healthcare services. And so, what can we do to alleviate those fears as well? So I kind of put it all in a nutshell, but I wanted you all to hear, of course, from the city's great health expert, Dr. Jenna Vegno, because she's just been so hands-on on this particular issue, and she can give us kind of an update on what the recent numbers look like. And then I'll put it over to Rosine as well, because she's really been leading on Hispanic heritage over the past several years and helping us with this kind of new spin on promoting Hispanic health as well. So Dr. Avegno, I'll turn it over to you.
Thank you, Councilmember Moreno and Councilmember Banks, for having me. This is critically important. As proud as I am that our team, and it was really a team effort between us, the state, and our local leaders to identify this early, and we should be proud of that. I want us also to be the leader in addressing it, and I think we're making some headway, but we have a long way to go. I'm going to just share my screen, if that's okay, and go through just a couple of, can I share my screen or not share my screen?
Hey, Paul, can you get her to share her screen, please, Paul? 1 second, Doc.
Sure.
I give it a shot now, Doc.
Perfect. Give me 1 second and I'll get, I think that as much as we may be PowerPointed to death, sometimes pictures are worth 1,000 words. So hopefully, let's get this going. So, Councilman Moreno, you said it quite eloquently. COVID-19 is a disease that disproportionately affects people of color. Councilmember Banks, I wanted to thank you publicly and personally for telling your story so publicly in the Advocate yesterday. That is a narrative that we hear over and over when we talk to folks in the community, but there are many in our community that is foreign to them. Your experience with this outbreak is in many ways shaped by your color, by your race, and by your ethnicity. It is a very different experience. And I think it is incumbent upon us to understand the experiences of all those in our community. Otherwise, it's a lot easier to minimize, and it's a lot easier not to take seriously. So thank you for sharing your story. This slide puts it into perspective. This is a CDC report from about a month or so ago that shows in pretty stark terms that most of our other major ethnicities or races, when compared to white non-Hispanic individuals, have higher rates of not only cases, hospitalizations, and deaths. And you'll see that some of the highest rates are among Hispanic or Latino individuals in terms of the number of cases and in terms of the hospitalizations rates. That's pretty staggering. This is national. This is not just a New Orleans problem. Again, I think we were able to identify it pretty quickly, but this is happening when I talk to colleagues in Chicago, New York, even in small rural farming towns, we are seeing these disparities. So, Councilman Moreno, you mentioned a little bit about our community-based testing. We were one of the first cities in the country to have widespread testing, and that started with our federal partners with our big drive-throughs at UNO. Even then, we were looking at those as while we were glad that they increased the number of tests that we were able to provide in a very rapid time. We knew that this way of testing was not going to work for many of our residents of color for a number of reasons. Number one, you had to drive. And when 20% of our population does not have reliable access to a car, and most of them are residents of color, then that excludes a pretty significant number of people. Also, although we are grateful for our National Guard partners, and they've done a great job. Getting a test by someone in a military uniform can be off-putting for a number of residents, particularly those in our Hispanic community who do not have legal status yet in the United States. And so we knew that this would not be accessible to them. So pretty immediately, we started looking to do testing in places where we could help those who had little access or little trust of the traditional testing mechanism and get them tested. So we started those in April. And even then, as we begun them, we started to notice that we weren't getting a lot of our Hispanic residents to the testing sites. And that's when we began to partner with faith-based organizations, with advocacy groups, with healthcare providers who had extensive experience and trust with Hispanic individuals to figure out where were the places that would feel safe and comfortable. And so that, we were able to do that starting in about April or May. So if you look here, these are just from our community-based sites. This is not a snapshot of everything in New Orleans, but this comprises thousands and thousands of tests over about the last 6 months. And you'll see that when we look at who came to get tested and what their positivity rates, our Hispanic residents are in red. Almost every month, they are orders of magnitude testing positive at a higher rate than white, Black, and Asians, and the overall positivity rate. Sometimes up to 7 times. What is promising about this graph is that, as you can see, as the months have gone on, we've shown some improvement. So whereas, in May, our Hispanic residents were testing positive at a rate of 22% of everybody that showed up to get a test, now it's about half that. That's still a lot higher than the general population, but it's reassuring that we're seeing some slowing of the spread. So, why is the question? Why are Hispanic residents and those around the country seeing higher rates of COVID, not just the infections, but also serious outcomes? And, for us, most things, it goes back to the social determinants of health. Compared to others, our Hispanic residents are more likely to live in multi-generational congregate living situations, particularly if they are new to this country, if they have come with family or co-workers, and they certainly don't have the resources to have their own homes with their own rooms. So it may be that more of them have crowded apartments where it's really impossible to isolate and distance. And so, we've seen that in our testing data. When one person at an address gets COVID, everybody at the address tests positive for that. There's also the question about access to care. We do have some fantastic healthcare institutions in the city, Luke's House, UMC among them, who have cared for all in our community, particularly immigrants or non-English speaking residents. But there's still some barriers. It's not as easy for those members of our society to get care. And so they might not know where to go for a test, or maybe the clinic that they go to isn't testing. Again, immigration status, there's a great fear that anything, particularly a testing that's run by part of the government, is going to require proof of citizenship or to cause problems for someone's immigration status. And that goes hand in hand. That mistrust of government goes hand in hand with mistrust of the medical system, some of which is unfortunately deserved because of past injustices. And then there's a language barrier. If you want to get tested and there is a testing site near you, what if nobody speaks Spanish? And then finally, your ability to isolate and quarantine is dependent on how you're going to provide for yourself. And if you are cut out of the system that allows you to have that enhanced unemployment or that stimulus check, then you can't not work. It's a choice between your health, your livelihood, and caring for your family. Most individuals are going to make the choice to care for their family, putting themselves and others at risk. So just some of the things that we've done, and Councilman Moreno touched on them, the Hispanic Task Force, that was something founded early. It has a wide range of members. It's really been a valuable place to understand what's happening in segments of the community that certainly the health department might not know, or maybe the city council or the mayor's office wouldn't necessarily know, and to work on partnerships with reaching even the hardest to reach sort of pockets of our community. We've had to do a lot of work, and this is work that we do normally, but really be intentional about partnering with community organizations, whether that's a tiny church in Kenner, whether it's Nuestra Voz, whether it's a more the Hispanic Chamber, a more established organization or traditional organization. It's really been all hands on deck in order to gain trust and to build the confidence of our Hispanic residents in the city. Again, we have tried really hard to put test sites in locations where our Hispanic residents will feel comfortable, and to have Spanish-speaking personnel not only at the sites, but also if we're calling you back with your positive test results and your native language is Spanish, we want to make sure we are giving you the information in Spanish. Otherwise, it's not going to be useful to you, and it's going to put you and your family at risk. And then as much as we've all racked our brains to try and provide direct support to individuals who are isolating or quarantining, we've been able to do that on a limited basis. We had some Tulane PhD students who were able to get a small grant and use part of it to basically make buckets of cleaning supplies and other basic things that someone who is at home in isolation might need. At our testing sites, for as long as we could, we gave out meals, we gave out masks, so that we could, just help folks through what we knew was going to be a very difficult situation. That being said, there's an awful lot of work to be done. As I said, my colleagues around the country are really struggling with this, and we're all trying to figure out the best way. I think we've made strides, but there's always room for more and to do better. So thank you guys for letting me present on that. I appreciate the opportunity.
Thank you, Dr. Avegno. And like I said, just a huge thank you to you and your team and to the mayor for just really leaning in to work on this particular issue. I mean, as soon as we started to see those numbers and I reached out to the mayor and I'm like, we've got to make a big deal about this. She immediately, was all hands on deck and said, let's do it. It is our duty to make sure that we are taking care of all people in this city, and making sure that everyone feels comfortable with coming to our testing sites and everyone feels comfortable with getting necessary care. I will say this, I think another big piece of our Hispanic task force, Dr. Avegno, have been our media partners, because Telemundo, very trusted news agency here in New Orleans, along with Jambalaya News and Viva Nola, they really have helped us to spread accurate information to the Latino residents in our city. And I think that that's been just a huge help. And of course, to Father Serrano over at the Hispanic Apostolate, he's just been amazing. Because of him, we were able to distribute thousands and thousands of masks to different congregations, to places that we were not aware were in need of masks, but they had been asking, and just we didn't get the message. And because of him, we were able to get those masks to where they needed to be. So certainly so much more work to do. I am glad to see that the positive rates are lower, but they're still 3 times as high than anyone else. So I agree with you, so much more work to do, and we'll continue doing this work. And that's one of the reasons why we wanted to continue to bring light to what is happening with this Hispanic Heritage and Health Month. So thank you, Dr. Avegno. Any questions for Dr. Avegno? Councilmember Banks?
It's not so much a question, but a comment that we keep getting the fact that this virus disproportionately affects certain segments of the community. We get it in different directions in different ways. It's unfortunate that so many people are still not understanding that that is where it is today. But as long as this virus is there, the reality of it is that it can spread to other segments of the community that have not yet been as negatively impacted. So pretending that it's not my problem is only going to make this problem last a lot longer. And we've got instances where people are just totally ignoring the warnings and totally pretending that it doesn't exist. And that is unfortunate. And until we actively accept the fact that we have to be intentional on arresting this virus, it is going to continue. This is going to be Groundhog Day. Now, we moved on past phase 1 and we are up to wherever we are now. But when the virus, if the virus boomerangs, then we're going right back. And we're going back and we're likely to be in a worse position than what we were before. And incidents, I'm gonna talk about this incidents that took place last night. I mean, we got pictures of a local bar uptown on Magazine Street that is just absolutely ridiculous. And those kinds of events are only going to make this worse. And at some point, I'm not sure what we can do to take far more punitive action against entities or individuals that just refuse to acknowledge the seriousness in this. But at some point, we have to make an example of someone. And if that has to be, then so be it. But people that ignore the seriousness of this virus are actually going to cause people's lives. And that is something that terrifies me. Now, you know, maybe my judgment is flawed. Maybe I'm not seeing clearly because all the tears are still in my eyes. Maybe I don't get it because I've lost so many friends, and people who have lost nobody, maybe they can't relate to this. But the fact is that I know from a personal position that this virus is real, it is killing people, and it's not over yet. Now, all of the national noise about a vaccine in the next couple of weeks, it's not likely to happen. And even if it does happen, it's not likely to have an impact that's going to be effective on people that are right now being afflicted by it. So spreading this message, I think, is critical. And hopefully we can get enough people understand that this is not just regulated to one segment. This community is one community, regardless of the level of melanin in your skin, regardless of the inflection you use when you speak English, regardless of the zip code where you happen to reside. We are one community. And the virus could not care less about any of those demographics. And I'm hoping that we can use those people that are dead now as the example and not have to get more before we realize how real this is. So I'm happy to be able to highlight this, and I'm also very frustrated that we have to. So with that, Dr. Begno, thank you. And again, we got to keep pressing, because this is not just going to go away. Regardless of what the president says, it is not just going to fade away. It didn't fade away in 1912. It's not going to fade away now. We've got to be intentional on making it go away. And I'm committed to doing that. And again, I know I'm going to hear the noise. I know I'm going to get the phone calls. I know I'm going to get all of that. But in the mortal words of Isaac Hayes, then so be it. Because I'm going to do what I think's right. And what's right is trying to protect the residents of this city and doing what we got to do to make sure that everybody who could be safe is safe. So with that, Councilmember Moreno, whoever your next presenter is, please.
Thanks. And I would just add, Councilmember Banks, you said it all so well, but you know, the virus doesn't care whether you believe it in or not, whether you believe that it's a problem or not. I actually read a story last night about a Nashville councilman who was very much promoting anti-masking and said that this was all a hoax. And, you know, saying that it was one political group just trying to make a big deal about, you know, this virus and whatever. And unfortunately, he passed away of COVID after fighting 5 weeks in a hospital. So once again, to your point, Councilmember Banks, this virus is very prevalent, it is very present, and it doesn't care whether you believe it in or not, it is there. And so the precautions that we've been talking about are critically important, and they must be taken. And unfortunately, we're in this still for the long haul. To your point, Councilmember Banks, that vaccine isn't coming in 2 weeks or 3 weeks or whatever. That vaccine is possibly coming out sometime late into 2021, middle of 2021. So, you know, that's at least what the experts are saying, and I'm always going to rely on the experts. Okay, so that's where I'm at. But we're very well put, Councilmember Banks, and I appreciate as Jennifer Vegno said as well, you sharing your story, because it helps people see that, yes, this is real and it is impacting people in this city in a very deep, deep level. So thank you. I wanted to turn it over now to Rosine Pemasanga. Rosine, you have, worked on making sure that Hispanic Heritage Month is always promoted very well every year. This national recognition that happens here in New Orleans every year from September 15th to October 15th. But this year, as I said, we've got a little bit of a spin to it. So I wanted to give you an opportunity to talk about that as well. Go ahead, Rosie.
Thank you, Councilmember Moreno. And just to clarify, I've not been working on this by myself. I would have been able to do it without Miss Eva Hurst. She's been very instrumental in the city. I've known her since I worked at the city council level, and she's been working on it. So when I joined the mayor's team, I made sure we team up again to make sure we don't lose it. It's something that is very dear to us, her as Hispanic and me as an immigrant. So we understand what it really means to recognize people. It makes people know that they matter. And so this year we started with the Consulate of Mexico. We were working on having a really big event because we were trying to reconnect with our sister cities in Mexico. We have 2 sister cities and they're dormant. It's Querétaro and Mérida, and both of them are dormant. So with the new council, our idea was to restart the sister city relationship with our sister cities, and we were gonna plan an event to happen on September 16th at Gallia Hall. So with COVID, it kind of faded away. We went up, we haven't been able to do anything, but we lit the Superdome on the 16th with the flag of Mexico, just to let people know, hey, you matter, New Orleans feels it, and we want to make sure you know that we celebrate with you. And so for the rest of the month, the event's happening on September 30th. The New Orleans Jazz Museum is having events called We Are Family, and I believe Councilmember Moreno, you were invited. The mayor is invited, and a couple of people, the Council of Mexico, the Council of Honduras, I believe the Hispanic Chamber of Commerce is also invited. And so it's gonna be a celebration of the Hispanic heritage in the city, because it's part of our history as well. So why not celebrate with our people? So that's one event on September 30th. Another event happening is with the Mayor's Office of Cultural Economy, the Embrace the Culture series. And so it's starting on October 2nd, and each week they will celebrate maybe, I'm not sure if it's each country, but they have some Hispanic performers to celebrate the Hispanic Heritage Month. And so the last event that we have, we are still coordinating that. It's not finalized yet, but what we're trying to do is have the mayor and the city council, Councilmember Moreno, and whoever is available to join in on October 15th to close the Hispanic Heritage Month. So we're gonna have just a representative of each organization, the councils, both of them. And just to mention, we also have a sister city in Honduras, and that's why those 2 cities matters. We have many countries celebrating this month, but these 2 matter because of our relationship with our sister cities. And that's why we highlight most Mexico and Honduras. So we are not leaving anyone aside. We're celebrating all the countries. We're gonna make sure we reach out to the Superdome and make sure we can also light the Superdome with all the other countries if possible. This is something I really wanna make happen. And when we reach out to the Superdome, they were really hands-on, and they made it happen for Mexico. I'm sure they're gonna do the same for the other countries. And we're really gonna close the month with Honduras, and we're gonna light the Superdome with Honduras colors. So there's something to look out for. And so this event happening on the 15th, we're gonna have it right at the front at the City Hall, and have the mayor, Councilmember Moreno, all the councils, you're all invited if you're available. We're still trying to figure out if it's gonna be a morning event or an evening event. And we're gonna have the Council of Mexico, Honduras, and the Hispanic Chamber of Commerce. And also we're gonna have some performances at that event. So everyone is invited. Make sure we keep our relationship with our sister cities and celebrate our communities because they matter. They participate in the economy. And so we have to celebrate. We have to keep the family together. If we can make sure they know that, I know everyone will be happy. So thank you, Councilmember Moreno, for having us. Thank you, councils, all of you for making sure this is happening today. And Dr. Avigno, thank you so much for the work you do. Thank you.
Thank you, Rosine. And of course, you know, this year the events have had to be a little bit different. We're doing a lot of more, part of these events are also virtual as well.
Sure.
Yeah, because I know that I've been asked to submit different videos or to come on via Zoom and things like that. But you know, that's the world that we're living in now. So I'm just so happy that we're still able to celebrate Hispanic heritage and still able to figure out ways that we remain social distance and can use, you know, obviously this new virtual technology that we're all on to be able to still participate in these events. So thank you so much, Rosine. Eva, I wanted to give you an opportunity to weigh in too. Eva, thank you so much for all of your work on this.
Oh, well, thank you. Thank you for having me. I've been working with the Hispanic community since Katrina. I was born in Honduras and been here since 1964. So I'm very excited to see how involved everyone in the city is. Being an employee of the city and seeing firsthand how much the Hispanic community really means to City Hall. It makes me feel really good as a Hispanic. I thank all of you and commend all of you for all of the wonderful work. Dr. Vegno, I'm really impressed with that PowerPoint. It's amazing. I'm a little bit emotional because I don't think I've ever felt this much attention to the Hispanic community. So thank you.
And Eva, I've been hearing that a lot. And even going back to when the mayor and I, along with all of our advocates, had a big news conference in Mid-City to talk about what was happening in the Hispanic community with COVID. I can't tell you how many people said to me, this is the most attention that they felt that they have received from an administration and a council. And but that's where we're at, you know, and I just very much appreciate the partnership with the mayor on focusing on the Hispanic population. It's only 6% of our population here in New Orleans, but it is incredibly important. And we will put all of our resources and everything we need to do to make sure that this community feels supported, feels important, and gets what they need, especially during this very difficult time of the pandemic.
Exactly. Like I said, when I was working with Catholic Charities, the Hispanic Apostolate after Katrina, doing all the recovery work, and you know that was some really intense work back then. But just to see the comparison and the attention that the Hispanic community is getting is just wonderful. So thank you, everybody, Rosine as well, Dr. Vegno, everyone. Thank you so much. Appreciate it.
Thank you. Eva Hurst.
And you hear it all in the community. It's in the community as well. So
I'm happy to hear it. Happy to hear it. Well, we do have a lot more work to do, of course. So we'll just keep at it, all of us. All right. Thank you so much, Dr. Avegno, for your time. Rosine Pemisagna, keep up the great work. Eva Hurst, thank you so much for helping with Hispanic Heritage Month as you do every year. Thank you. All right, Councilmember Banks, I will turn it over to you if there are no further comments.
Any questions from any of our colleagues? All right, well, thank you. Well, thank you all for presenting, and we will we'll move on to the next agenda item, which is a presentation from the Main Street Recovery. She had to leave. Okay, then we will actually have to postpone that, or do we have anybody here from?
Yeah, I'm here, Councilmember Banks.
That's Mr. Morris.
Yes.
Awesome. So if you could still give us your portion of the presentation from the Main Street Recovery Program item. This is relative to, again, Main Street Program. So I know we lost Lynette. She had to leave, and I want to reschedule that. I apologize, Lynette, for running over, but we should have factored in the time with requiring the public comment period. So let me apologize for that. So with that, Chuck, if you would proceed.
Thank you very much. It's a pleasure to be with you this morning. I am the Executive Director of Thrive New Orleans, and we have a small business pillar called Launch NOLA. And we have been in the trenches with small businesses. We've served over 200 small businesses and helped them with their PPP in their idle loan process. We're now in the process of helping them with a Main Street Recovery Grant, which is a little bit different. Of course, the PPP and the idle was a federal grant program. This is more of a state grant program where the state will reimburse eligible small businesses for up to $15,000 in expenses due to COVID. They have a total budget of $270 million. This grant is eligible for Louisiana companies with 50% of the company must be owned by someone who resides in the state of Louisiana. It started off as being a somewhat of an arduous process. And the companies that we were working with, they were really skeptical about being part of it because you had to really dig deep. You had to go find all of your receipts, but I'm very thankful that the treasurer, the state treasurer, changed some of the provisions. There's now a quick relief program where you can use your tax returns, itemized tax returns and expenses for reimbursement. And that has made a world of a difference. So now they're getting so many more applications. We're helping so many more people be part of the Main Street Loan Program. The average loans are about right now $10,000 per business. And part of this is part of the quick relief program. But in early September, the average loan was $4,000. And I'm going to quote the Treasurer Schroeder saying on September 15th that many applicants have been denied due to not filing their taxes. You have to file your taxes, not being current with the Secretary of State, or not being truthful when it comes to notating whether or not you receive federal assistance through the CARES Act, through PPP and EIDL. That does not exclude you from being part of the Main Street program, but what you did receive from PPP and EIDL will be deducted from the funds you receive from the state. Applicants are also asked to provide the amount of prior aid they received. We just talked about that. We're so happy about the quick relief options because many small businesses, especially businesses of color, are now able to use their tax returns to be able to be qualified for these loans. Also, $40 million was set aside, or I don't know if I can use that word, but set aside for minority-owned, women-owned, and veteran-owned businesses. To date, that $40 million has been depleted. So $40 million of that 275 have gone to women-owned, minority-owned, and veterans as of September 18th. That goal has been met. Let's talk about the numbers real quick. There have been 30,000 applications submitted, 4,889 applications awarded thus far. 170 million of the 275 million have been obligated for small businesses. And we're at the midpoint now. We still have more money to give away. The average grant issued is $9,842. And the process is still moving on. The actual the closing date for applicants is November 4th. So we're still encouraging people to apply for these grant opportunities. And if you receive a PPP or EIDL, you still qualify for this opportunity. I want to talk briefly about the quick relief program, and it's really less arduous, of course, and you can use your tax returns. And some of the eligibility part is that it covers costs incurred during COVID, which includes rent and utilities, as well as any extraordinary expenses that have risen. However, it does not cover lost revenue. It does not cover lost revenue. Business do not need to be incorporated. Sole proprietors are encouraged to apply using their social security number rather than the EIN. They must have proof of expenses and have tax returns from 2018 to 2019. And those expenses must be reflected in their tax returns. The question is, can I, as a sole proprietor who has a house, have rental property, can I apply? You are encouraged to apply. Now, you cannot receive money for lost expenses, but you can receive money for other things, costs that you have occurred because of COVID. As I talk more about that, landlords are encouraged to apply. Their revenues from rentals must be included in their tax return Schedule C, but the program does not reimburse for lost revenue. But interest expense, maintenance fees, cleaning, those are some of the things that are covered for landlords in this loan process. And last but not least, eligibility. You must be domiciled in Louisiana as of March 1, 2020, suffered an interruption of business, at least 50% owned by one or more Louisiana residents, file Louisiana taxes 2018 or 2019, or have received an extension for 2019, have no more than 50 full-time employees as of March 1, 2020, and have customers or employees visit a physical location. What does that mean? That means that you must have someone either come into your store, your shop, or you must have a company that go out to different locations to maybe electricians, plumbers, that sort of thing. But it must be an interactive relationship between the customers and employees. Are not part of a bigger business which with more than 50 employees. You can't be part of a chain that has more than 50 employees. Does not exist for purpose of advancing partisan political activities, and does not derive income from passive investments or active participation in business operations. That's just an overall synopsis of the Louisiana Main Street, Louisiana Main Street grant program, and I'm definitely welcome to take any questions you may have.
Rev, I want you to go back and highlight, and I want you to be clear on this. If a group of grandchildren have inherited the grandmother's house and they're renting it, and the tenants have not been paying rent because they've been given the ability to not pay rent because evictions have been halted.
Right.
Are those type of instances eligible to apply to Main Street for relief?
For relief, but they cannot apply for Main Street for the banks in relief for lost revenue. So because that tenant cannot pay their rent, they cannot receive provisions to cover the rent they lost, for revenues they lost. Now, if that person left the house, left it in disrepair, they can apply for the funding can be used to help with restoring the house, can help with other expenses, but not lost revenue from not receiving rent.
Chuck, can they receive it, like, say, for utility costs? Because some
They can,
small
yes.
landlords pay for utility costs.
Yes.
Okay.
And I guess where I'm going with this is that we're going to be working on trying to get the language amended in the Enabling Act to allow for passive participation, folks that have passive income, passive owners, to be able to participate. The fact that by definition, these small landlords don't fit the definition of a small business, but in essence, that's what they are. And while they currently cannot apply for lost income, the fact that the tenants were allowed not to pay did not make the responsibility of the property owners for their property taxes, for their mortgages, for their maintenance. That didn't go away.
Right.
So we've got to get a bridge somewhere between where we are and where we need to be to help those type of folks. Now, again, the businesses with 50 employees and all of that stuff, and the big mega landlords, I get them. But I get calls daily from individuals and family members of groups of families that own these houses that are put in a very bad position because now they're stuck.
Yeah.
And I promise you, the property taxes did not go down or go away. It's because of COVID.
Yes.
And the mortgage companies did not suspend the need to pay the mortgages. So I'm hoping that we can have a way to adjust this through the legislature to be able to help those folks. But in the meantime, I want you to go over it one more time, that they can apply for maintenance money. They just can't apply for rent money. And would you clarify, Rev, can they, the maintenance money, do they have to spend it first and be reimbursed, or can they apply for it to get it and then go do the maintenance?
They can apply for it and get it and do the maintenance. I think it's important, Councilmember Banks, to understand that just because they can't receive funding for lost revenue through rent, there are litany probably of other expenses that they will have to incur as it relates to their rental property because of COVID. I mean, we're talking about interest, we're talking about maintenance, we're talking about cleaning, we're talking about utilities. So just because they can't receive, and yes, I'm with you 100%. I think they, that it'd be great if they could receive this grant for lost revenues, but there are other ancillary things that I think that they can receive funding for, and they should really try. We try to work through the pace and change legislation, do that sort of thing, but also help them understand that to look at those other things that they could use those funds for.
And of the funding, how much is still remaining?
Right now, as of the funding that's remaining as of now, it is, and I'm going to get my numbers together for you. Here we go. They have $170 million of the 270 170 million of the 275 million have been obligated as of today.
So a little bit better than 100 million is still available for people that have not yet applied to come in and apply.
Yes.
So I want to be very clear on speaking to the public that you should come and try to do this. The most they can do is tell you no. But if you're in a position where you need the help, then let them tell you no. Don't be reluctant to apply, because there are ways to access some of this. Again, you can't use it for the rental income, but the maintenance that did not go away. Can you use this for property taxes?
I'm not sure.
All right, and I don't know that. So, I mean, that's something to take a look at.
Yeah.
But we could also look, and again, I don't know if that's legal or not. I don't want to encourage anybody to do anything that's not legal.
Right.
But maintenance, we know for sure you can use it for that.
Right.
So those mom and pop landlords out there, please take a look at this, because this can get you some help. And I just want to do two housekeeping pieces. I know we have a slideshow that's up on the website, so all of you all are looking can view the slides. They're a part of the agenda meeting page. And before we go to public comment, colleagues, do you have any other questions? All right, with that, we will go to public comment. I'm not sure how many we have. We have 2 public comments, so if you would please read the public comment.
Andronika Morris, representing Greater New Orleans Housing Alliance. If the people of New Orleans do not remain housed, there will be no economy to develop. We need the Main Street Recovery Program to go further by allocating funds for landlords who have lost significant income from continuing to house tenants who are unable to pay rent. A disastrous but preventable housing crisis is brewing. Eviction moratoriums will not have a positive effect once landlords are unable to continue paying their mortgages and for maintenance. Louisiana ranks second in the nation for at-risk mortgages, with more than 11% of home mortgages in the state past due on payments or in delinquency as of June. Those at the socioeconomic bottom will be hit hardest, and the cycle of displacement will be exacerbated unless we find solutions to protect both the renters and landlords in New Orleans. As a state, we still rank #1 in COVID cases per capita, and we have yet to recognize the need to put housing first and to recognize that housing is essential if we are to survive this crisis. The next comment is from Anthony Doby, not a paid representative. Hello, and thank you for taking my comment. I see this is the Community Development Committee meeting today, so I was very curious to see if this committee would explain to its community the underdevelopment of one Jared Brosette. While not in public office in 2006, Mr. Brosette was convicted of driving drunk in Miami, Florida. Jared was bailed out of jail by a New Orleans code enforcement director, Winston Reed, for some unknown reason. He only received probation and had to complete a DUI education program. This education didn't serve him well because now in June 2020, some 14 years later, he was caught driving drunk again, this time committing a far worse crime than in 2006. This time he upset and ruined another person's life other than his own, and it remains to be seen whether he will get a lesser or worse punishment here than he did in Miami in 2006. The unofficial gag order by you on the council seems to hint that he will be protected from proper prosecution. Can any one of you, especially those with a legal background, explain this to your constituents? How can this person, who has now repeatedly demonstrated the inability to make the right choices and develop as an adult when it comes to choices surrounding alcohol over the last 14 years, sit on this committee and be in such a position when he was shown by his actions and choices that it is too big for him to handle? There is no shame in Jared stepping down from the council, seeking out more than just a few hours of counseling for the illness he has, and then trying to come back in a few years once time has allowed for public healing and hopefully his own personal growth. There is shame, however, in what is going on in this council, and you're all an appalling part of it with your continued silence on the matter. Thank you. That's the end of public comment on this item.
Okay, thank you. So with that, I want to close this by saying thank you, Reverend. We are going to be working with you to try to get this information into as many households and as many businesses as possible to take advantage of this. Unfortunately, I don't think that we are near the end of this crisis. I think that we probably got a good ways to go, and folks are going to need help and relief. So with that, I'm going to pledge a commitment to you that we're going to continue to work. I have been in conversations with folks in Baton Rouge to try to come up with language that will allow for those small landlords to participate at a higher level to figure out how they can get some of that missing rental income back to them, because I think that that will make a big difference in trying to level this scale. So with that, thank you, sir, for your participation and information. I also do want to address the last comment about somehow being a part of some massive conspiracy. That is not the case. People have a right to say what they want, but as a member of the city council, I have no jurisdiction over any other member of the city council. Individuals who are elected by the public are answerable to the public. I have no authority over anyone to make them do anything. So be clear on that. So I have said publicly that anyone who has done anything that they should not have done should be held accountable. I stand by that. But please know that me personally don't condone any misbehavior, but I also am under understanding and the ability to understand that I have no authority over anyone. So with that, let's move on to the next agenda item, which is a presentation of the city's rental assistance program. To present Ms. Ellen Lee and Ms. Margiana Willman.
Good morning, council members. My name is Ellen Lee. I serve as the Director of Community and Economic Development for the City of New Orleans. Margiana Willman is a part of my team running the Office of Community Development. You know, the presentation that preceded us, you know, really speaks to the need to have this, address this challenge from many different angles. businesses and those landlords being able to apply to cover their expenses is certainly one component of giving them the assistance they need. But we know that the best way for landlords also, to be made whole and to have the resources they need is for their tenants to be able to pay rent. And with the times that we're in, with so many people losing their source of income, that has just been such a challenge for so many people. We understand the hardships of that and the impacts that it has not only on those tenants, but on those landlords. And so the Office of Community Development has been working extremely hard to develop programming across the board that's really going to serve a variety of our residents, everything from those persons who on unsheltered homeless populations, getting them into off the streets and into stable housing, looking at the rental assistance that our people need, not only for those who are needing to pay rent to get caught up and to stay caught up, but particularly right now for those who are in imminent danger of being put out on the street. And also just really while we continue to develop more affordable housing and support the development of more affordable housing to meet the needs, not just for today, but in the future. So we really are working this from a lot of different angles. And I also must say that we were also delighted to be able to provide some support for some of the businesses like Launch NOLA, working with the New Orleans Business Alliance to provide some support for them financial support for them to help them to assist these small businesses, landlords, those applying for the Main Street program and some of the other economic recovery programs. So with that, council members, I'm going to turn it over to Marjorie so she can walk through the presentation that you all have to talk about the different initiatives that we have to help people with their housing needs.
Thank you. Thank you so much, Ellen. I just want to take the opportunity to go over some of the initiatives that we have in response to COVID, and they've been threefold. We looked at immediate, midterm, and long-term ranges in terms of responding to COVID, and I'll just go over those, and also just to say what type of funding sources we were using to cover those responses. We received about $20 million in CARES Act funding so far, or we're planning to receive some of those funds we have not yet received. But when you add all this up here, it's about 20 million, and you'll see it's a combination of CDBG, ESG, HOPWA funds, and of course, with each funding source, there are different strings and requirements attached. So we are using the funds in ways that are best responses based on the funding source. And we could just go on to the next slide, and I'll break down how we're using those funds. The initial response was rapid rehousing. That's when the state worked with the city to go out and pick up those individuals that were unsheltered homeless. About 700 people were assisted. There was a partnership with the state, LHC, Unity, the Continuum of Care, as well as the city. And many of those people have been placed into permanent housing already. Over 200 have been rehoused. Some of them have their own units now. Some have moved back home and were allowed to move where they needed to go. Some are receiving assistance in terms of rehab, treatment, or medical assistance, but that program has been a very helpful program to get those off the street that did not have any shelter, and also to protect them from COVID. You know, we know that you're most safe at home. So that was one of our initial responses to get those individuals off the street. We're also partnering with HANO for the housing choice vouchers. HANO, Housing Authority of New Orleans, has dedicated and committed 225 vouchers for this purpose for rehousing individuals. So we're using a combination of our ESG funds, CDBG funds, and the Hano choice vouchers for this, and as well as funding through the state, because the state is paying for the hotels, which is going to be reimbursed with FEMA. So it's been it's been a collaboration of many partners, and it could not have happened without those various partners. Also, what's been very helpful is the case management. The mayor has always been very firm about providing case management for people, not just taking them and putting them in housing without them getting the resources that they need to be successful and for it to be sustainable. And then very early on, we have been told that we were one of the first in the country to roll out our rental assistance program. That program has evolved to an imminent risk of eviction program. So now we actually have two programs. We have the main program that we started back in March, and we received over 8,000 applications. We're working with a nonprofit, Total Community Action, and they're continuing to go down that original list, and they've served a good deal of people through that list. But we also did just recently in August fast track, and so that track is for individuals that are in imminent threat of eviction, meaning people that without any type of assistance are likely to be evicted within the next 2 to 4 weeks. So those people are fast tracked through the process, and anyone who's assistant with rental assistance, they have to have been impacted by COVID. These are CARES Act funds that were issued and released as a result of COVID. So it's very important that we have to connect those funds back to a household that has been impacted by COVID.
Marciana, can I interrupt you? I'm sorry, do you mind if I interrupt you for a minute?
Mm-hmm.
First off, we're talking about the rental assistance funds. How much are left in that pot?
The original pot, it's about $1 million left in the original pot. Let's see, apologies. There's about $1 million left, not the original pot, but we have a 2.8 million in that was dedicated to rental assistance, and so there's about $1 million left.
Okay, and then you say affected by COVID.
Mm-hmm.
You're saying that if you lost your job because of COVID, or if you're only working part-time now because of COVID, those would be eligible.
Correct. Those, or also you may have illness that prevents you from working because you're more susceptible to the disease, or it may be related to your hours have had to be reduced because the assistance with childcare is not available to you. So it could be a number of factors where you're touched by COVID and you're not having the same income that you had before and you're unable to pay your rent.
So Marciana, we've been hearing about so much need, right, in every aspect of the community. I'm really a little surprised that there's $1 million left. Mm-hmm. Have y'all not received enough applications, or have applications been denied?
I can tell you this, the process for assisting people in the rental assistance program is a lengthy process. So we have to have documentation. And what I have seen, not just with the nonprofit partners that we're working with, but I've also seen it with the state, because they have also rolled out a program, and that's the 5.6 million that they have made available for rental assistance just in New Orleans. And
so we also have the 5.6 available in New Orleans. Yes. And how much of that's been expended?
Not a large amount, and I have those numbers here.
Wait, this is insane. I mean, we're in 6 months, right?
Right. So let me just.
And then we've got, and just like Jay said, there are a ton of small landlords that are hurting. You know, they're in danger of their properties being taken by the banks, right? Because they can't pay their mortgage notes because people aren't paying rent. And I'm hearing we've got around $6 million sitting out there that's set aside for New Orleans for rental assistance, and we can't get it to hit the streets.
Well, I can tell you
I'm not putting this on you, Margie. I know how hard you work, and I've got a ton of respect for you. I'm just trying to get to the crux of the problem here, because if it's paperwork issues, is it paperwork issues? Is it staffing issues? I mean, what's the deal?
It's a couple things, and let me just explain. So part of it is that people will apply, and I know that TCA experienced this, and they go down the list. When they reach the person is saying, oh, well, I was able to get unemployment, I no longer need help, or whatever, or sometimes they don't have the documentation they need, the landlord is not responding. It's just that type of connection that is just a lot of it's been difficult to break through. We do have some people that come in, they bring their information and their rent is taken care of very quickly, but we do have some people that I can't get off from work right now, so I have to come in next week, and maybe they don't come in, maybe they can't provide the documentation they need to provide. And that's just some of the delays that we're running into. I do know LHC plan to do an outreach event at UNO September 18th and 19th, because same thing, it was oversubscribed. That program was only open for about 3 days, and then they had to close out the applications, but they've only been able to disperse $115,000. So it's not isolated to.
Wait, I mean, I'm sorry, the out of the 5.6 million, they've only been able to disperse 100,000
actual dispersed, because they're having trouble with the tenants coming back, bringing in the documentation.
When the check is cut, is it cut directly to the tenants or is it cut directly to the landlords?
Directly to the landlord. So we have to have communication with the landlord and the tenants.
So is it possible to flip the script? Is it possible to have the landlord come in and apply on behalf of the tenant? Is that possible?
Sure. So a landlord could come in and apply on behalf of the tenant. That information is out there, but again, those same requirements would still have to apply to the tenant. So if a landlord come in, we still would have to go to that tenant and make sure that that tenant, we're only paying what is needed to cover their rent. We're not over subsidizing that tenant. And that they qualify for those funds. So yes, they.
But also, Christelle, but like if a tenant doesn't even want to deal with it because they know they're not going to be evicted, they're just not going to deal with it. And so meanwhile, these small landlords are hurting, have no recourse.
Yeah. So
that's what I'm, right? Jay, do you see that?
That's the issue. I mean, if the tenants aren't motivated, they can't be evicted, but the landlords still have the pressure that they have. So.
And then meanwhile, there's $6 million sitting there for rental assistance. $6 million for rental assistance in the city of New Orleans, and it's not being dispersed.
Well, it's
not your fault, Marjana. It's not you. I know it's not you. I'm just saying it's the system that we have here, and it's blowing my mind right now.
I just want to be very clear as far as the state, because I do know that the state has worked very hard as well to put money on the street. So
yeah, but they've failed. But the state has failed if they've only given out $100,000.
Yeah, so
then they have to fix the program.
Yeah, and I
maybe
agree.
Fixing the program means that what Jade just said is you let the landlords go directly, and they just prove that they haven't received, rent in X amount of time. And then, so maybe we need to get all of our state legislators on board for this.
I think, council member, we also need to look at the requirements for the source of funding. I think you make excellent points. We need to look at the requirements for the source of funding. So if this is HUD funds, for example, the assistance really, although the payment goes to the landlord, the assistance is to the tenant. And so one of the reasons that landlords, even if they come in to apply for the resources, it really is that the assistance is going to the tenant, which is, to Margiana's point, why we need the tenant to also be cooperative, because the tenant really is the applicant for the assistance and not the landlord.
I hear you, but because there are no more evictions, there's no incentive for some tenants to go take care of the problem because they're fine.
No, I understand. And I think that one of the
we're at risk of losing built up wealth and equity and I'm worried about the small landlords, right? I'm worried about the mom and pops who put their entire life savings into a shotgun double or into a fourplex. That's how that's how they retired, or that's how they're living. They still have a note. Now they can't pay it. And there's $6 million out there. And then somebody winds up taking their property.
Oh, no, ma'am, you absolutely agree. And again, I think that we need to explore all of the options for how we get the assistance to the landlords. One of the things that Marjorie and I have been discussing is ways to fund, and look, to everyone's point, if people aren't motivated because they know they're not going to be evicted, I don't know what we can do about that. But on the other hand, in 3 months when the moratorium is over, this rent is not forgiven, right? It is just really deferred. The landlord, the tenant is still going to be responsible for their rent for all of those months. So we're thinking about ways that we can support organizations that can do some counseling with the landlord and tenant to, negotiate, maybe work through some kind of arrangement for those people who can pay something. We know that people who've lost their source of income, it's going to be a challenge. But if I've been receiving unemployment assistance, if I'm going back part-time, we know that as some businesses are able to reopen, maybe there's opportunity for the landlord and the tenant, to work together so that the landlord can receive some payment, because in January, unless the moratorium is extended even farther, we're going to still be back in the, oh, you can be evicted, and trying to prevent us getting into that situation. But
Ellen, the eviction isn't the issue. I don't think that the landlords want to evict the tenants. The landlords need the revenue in order to sustain themselves.
I understand it.
Having the inevitability of eviction isn't going to make a difference. The fact is that I'm hoping that we can figure out a way to get them the cash that they need now, so that they don't get in a position of, not only will the tenant be evicted, but they're going to be evicted too, because the bank will come and repossess their house.
Absolutely.
100%
agree with you.
And I think what we might want to do, and these are all good points, and I think that we need to provide maybe more outreach to these small landlords and let them know that if you can work with your tenant to come in and apply for these funds. So yes, the funds they would pay the tenant's rent, but it'll go to the landlord. But if that landlord knows, I have a tenant who's in this situation, I can go to the TCA, the city, and get assistance, it would help both the tenant and the landlord. So what we'll do is we'll provide some outreach to landlords, just to let them know that those programs are still out there and there's funds still available. And these are tenants that would have to qualify for the programs, but still they can work with them to come in and apply for the funds.
Yeah, because I agree with Jay. Landlords don't want to evict people. Nobody wants to evict people, especially now. But at the end of the day, you still can't get blood from a turnip. I mean, if you can't pay rent now, you're out of a job, or you can't work, you have all these issues. How are you going to, once you do get back, in January, February, how you've got all this back rent and now you're just starting work? I don't see how you can pay back rent. And
yes,
we're putting everybody in an untenable situation. So they're just going to move, they'll just move someplace else. And then the landlord is out of money, no one's going to want to pay legal fees to put, to track down somebody who's left the property or try to sue them for a lost lease. No one's going to want to do that. No one's going to have the money to pay for lawyers to do that. And everybody knows it. So it's going to be the small landlord, and what bothers me about this is that, we heard in the presentation earlier about, lower socioeconomic levels, especially in the African-American community, Hispanic community, are getting hit harder with the health issues. They're also getting hit harder with the economic issues. And this is going to play out again, in terms of if people are getting their properties taken away from, because they can't pay their mortgage to the banks. And it's going to be the same thing like Katrina. We lost 10 percentage points for home ownership or property ownership in the city because of that. And I see the same thing playing out now.
And and guys, let me ask just to.
And again, I'm not saying y'all did not create these programs. I'm not saying it's your fault. I'm just saying for every action, there's a reaction. And my fear is that we will lose ownership of properties in socioeconomic groups that are going not to be able to withstand this kind of pressure. And it's played out in every other disaster that we've seen, right? It's always those vulnerable populations that get hit the hardest. Y'all know that better than anybody, right?
Do you all have any information or any just conversations with folks as to why the tenants who are eligible are not applying? Any way to know what the reservation is?
So they are applying. So the programs, both programs, the state and the city, people did apply, but they did not follow through in some cases with the application process. So
and how do you need a PhD to fill out the application? If you were laid off because you are no longer working in the hospitality industry, there's a high probability that your educational level is not as such that you can go and fill out a 500-page application. What would make somebody who needs help, who started a process to get help, all of a sudden decide, I can't do this? What would make that happen?
I think there's been some disincentive because of the moratoriums, but the application process is one page. I mean, you do have to provide documentation that we can't change, that's required. We have to show the outcomes for any funds that we use that are federal funds. We have to show that those funds were used properly. But the application process is not a difficult process.
On the city side, right, Marjorie?
On the state as well, because they did consult with us when they rolled out their program, and it's not a difficult application process.
So the city's application is one page, but the state is 58 pages, right?
No.
I just want to be clear. If it's not 58, it's 57. It's almost 60 pages for the state application, correct?
No, the state application for rental assistance is not a long application. It's pretty.
And then I will have to clarify that. I was given information that it is almost a book that people need to complete. And again, if you are not as academically astute as some others, then you may very well have a built-in deterrent to going to try to ask for help. And I think we ought to be doing this just the other way. We ought to be doing this thing to make it as easy as possible for those folks that we know are going to be impacted to apply and to get the benefit. Because the people that are going to be most affected by the inability to pay their rent are the people that are likely to have been laid off. And those are the folks that are in the industries that they cannot work from home. Everybody with a good office job can do their meetings by Zoom, but there's no way a bartender can serve a drink by Zoom. There's no way someone working at the front desk of a hotel can do that by Zoom. There's no way people in the hospitality industry can work by Zoom. So I just think that we ought to be looking at making whatever adjustments we can make to make the process easier. It's hard to rationalize $6 million still sitting on the table when we know we've got a desperate need for it, and folks that need it not applying. So again, I'm not beating anybody up, and I understand we got to play the cards we dealt, but there's got to be a way to figure out how to mitigate this to get people more into applying and receiving, because this has a multiplier effect.
Right.
The fact that the tenant isn't paying is building up on him or her, and at the end of this moratorium, they're going to be liable for it. But again, the landlords, their businesses are still operating every day. Property taxes are not going away. The mortgages were not suspended. The maintenance still has to happen. All of those things that they have to do, and now they have to do it with no money, is of a concern. So again, I'm not beating anybody up. I want to work with you all to figure out what can we do, and if it's more education, if it's more outreach, if we need to do whatever we need to do to get people to come in, tell me that, because $6 million on the table, we ought to be able to use this here.
Yeah.
Exactly. And my bigger concern going down the line, right? We have to look at this $6 million as economic, as an economic infusion into the city, right? And it is economic stimulus money. And I think we have to be very cognizant too, is, hey, this money isn't going to stick around, right?
Yeah.
There is a history of people sweeping the money. If it's going to New Orleans, if we can't spend it in 6 months, a year, there are going to be other parishes trying to snatch up that money. So let us be your partner and help, whatever we can do to start pushing this out there. Are we working with landlord associations and all those folks as well, and HBA, and to really try to get this information out there? I just don't want people to lose their property.
Right. No, and I agree with you. And we will look at our programs. We will work with the state and see what we could do to make changes. I do know that they did have an outreach event at UNO to help those with that process their applications on site and receive documentation. So I'll find out where the status is. There maybe perhaps after that outreach event, they were able to disperse many more millions of dollars, but definitely I agree that whatever tweaks or changes that need to be made to make the programs more effective, I'm willing to do that.
Yeah, it looks as if the state's program, the applications have been suspended because they've received, I don't know the number of applications, but apparently I would infer that because it's been suspended, they've received X number of applications and they're working through that list. Yes. So whether they've dispersed the amount that they've dispersed, these outreach efforts seem to be less about getting people to apply and more about, for the people who have applied, getting them across the finish line by helping them with, getting the documentation and other supports they need to get the help. But we'll get updates from the state also so that we can communicate back to you, as Marjorie said, on how successful that outreach effort has been, and if we all can do more to support more of those kinds of efforts so that those tenants can be successful in getting the assistance so that their landlords can get the resources that they need to prevent the negative outcomes of them losing their property.
Great. Thank you, Ellen. I appreciate that.
And Ellen, one final question, and I realize, again, we've got to deal with the regulations that are there, but if you all could look at if there's any way to permit the landlords to be able to certify their tenants and do it that way, I'll guarantee you the landlords are probably far more motivated than many of the tenants. And the tenants, again, I mean, many of them have a past knowing that nothing can happen to them. So unfortunately, you do have people that will take advantage of a system or a situation, and that's what's happening. But the landlords, I guarantee you, are far more motivated. So if there's any way, if you guys could look at that to see if there is some adjustment or some way we could, thread the needle to let the landlords apply so that they could get the help needed.
Yeah, we'll explore that, council member. HUD had issued a good amount of waivers, with these CARES Act funds. So we'll explore, some things are statutory, as they can't be waived. Some things are regulatory. We'll certainly look at everything that's possible.
Okay. Colleagues, any other questions? Did we have any public comment? Okay. Colleagues, any other questions before public comment? Okay, Ellen, you all finished?
No, there's just some more here. Let's see.
I'm sorry, then I didn't mean to cut you off. Go ahead.
Okay, and I'm trying to move it to, okay. And so I'll just go over these quickly, but we're also providing eviction legal assistance through Southeast Louisiana Legal Services. We know that the outcomes of households and tenants are much better when they have legal assistance. So we're providing that service. They've been very helpful, Laura Togo and her group. Then we also have our tenant-based rental assistance that we're using home funds, a portion of the funds that the state is also using our home funds, and that's a form of our rental assistance as well. Next slide. And then we have our HOPWA funds. Those were the CARES Act funds specifically for households with individuals living with HIV/AIDS. So we're also providing short-term rental, mortgage, utility assistance through that program for 190 persons, households. And that we're also working with the Continuum of Care on that program, as well as our sponsors that we have that support the HOPWA program. Okay, and then our shelter expansion and rehabilitation program, that's what we're doing, also kind of like the midterm goals, and we're expecting to have 300 additional beds by the end of the year and a total of 400 additional beds for the city. And the reason why this is really important is because in a post-COVID world, there will be times when we need that that distance. And so this will allow us to provide that in our shelters, also to maintain shelter space that we currently have. Some of our shelters have had quite a bit of deferred maintenance. And so we're able to go in and help them, as well as increase the capacity of the low barrier shelter. And then some of our other shelters, 5 other shelters were awarded through this program, a total of $12 million to increase shelter capacity. And a portion of that, I'd be remiss to say, a portion of that $12 million came from funds that we had awarded to our projects in our 2019 funding round. We received funds from state OCD, piggyback CDBG funds that they were able to allow us to use for those 2019 projects. And then we were able to pull that money out and use it for COVID response and COVID related activities. So we were very fortunate for that. So in addition to the $5.5 million for rental assistance, the state has also helped state OCD with about 10.3 million for us to use for COVID related responses. Next, okay. And that's it. And then our long term, of course, as Ellen said, was to continue to build and preserve affordable housing. We did put out our NOFA, our notice of funding availability. It went out September 1st. This is the 3rd for this administration. We try to do it the same time every year. So we put that out on September 1st, $7 million for affordable housing development. We just had a call this morning for our pre-conference, pre-submission call, but we expect to have a large application pool for that as well. Thank you.
Thank you. And I think we've got, there were no comments from my colleagues. We did have public comment?
There's one public comment.
All righty, sir, if you would proceed.
This is from Andronika Morris, representing the Greater New Orleans Housing Alliance. Last year, half of all renters in the city of New Orleans were cost burdened. In June, Enterprise Community Partners estimated that Louisiana needs $250 to $500 million to keep renters in their homes through the end of 2020. Federal assistance has ended and there is no sign of stimulus checks in the near future. It is terrific that the city is taking some initiative in securing and allocating funds for renters. Unfortunately, we know that it will not be enough to keep everyone housed and secure. We need our leaders to secure even more funds for housing. Additionally, there is a need to keep the requirements to apply for rental assistance low. As stated, before New Orleans was already in a housing crisis pre-COVID, neglecting to pay attention to our essential workers who have not lost income but still struggle from low wages and no hazard pay is a tremendous loss. Housing is healthcare, and right now we need everyone to remain housed as we enter flu season and continue to get a grip on COVID. That's the only comment on this item.
Thank you, sir. So I think with that, that is the end of that presentation. So we will continue on with the agenda. And I think the last item is, we've had much conversation in and around evictions. So this is a presentation by Austin Bedon, the clerk of First City Court, relative to eviction procedures and updates. And Mr. Clerk, would you please begin?
Good afternoon, everybody. Thank you for having me here. As clerk of First City Court, some of the things that myself and my staff are charged with, we are purely the administrative portion of First City Court. Here at First City Court, we handle evictions, we handle small claims, and civil cases $25,000 or less. As you've been talking about, and rightly so, the eviction crisis is huge going on in this city, as well as in other municipalities throughout the United States. There are some things I would like to correct is people can be evicted for non-payment of rent. That is a possibility. The tenant is responsible for a declaration, and that declaration must be given to their landlord. So we have a number of cases that are pending right now in First City Court, but it's a very fluid situation because it changes week to week, sometime month to month. And you have the feds that are involved, the state is somewhat involved, and the local administration is involved as well. My office doesn't give out any legal advice. We can't even say what we suggest or what we would do. But again, it's very fluid. And the Federal CARES Act, which was quite popular and a lot of tenants knew about, that has since subsided. So there is no more coverage under the Federal CARES Act. You know, this is something that negatively affects people and families. It really pains me to know that there's going to be a lot of families and children who are going to be thrust in a situation where either they're going to be homeless or they have to cohabitate with someone else, other family members, which is in total contrast of something that we don't want to stop the spread of this deadly virus. But unfortunately, that's the situation at hand. We have 4 outstanding judges here, and you know, they have to follow the law. They don't. I've been in conversation with these individuals. They're not looking to put people out, but they have to follow the law and do their job. But I understand the plight of landlord as well, because I tell you, I hear it every day. The landlords still have bills, they have mortgages, they have insurance. Many of them have utilities. And so therefore, and also taxes. The tax bills are going out, I believe, in December. So, you know, I understand the plight of the landlords. You got about 53% of the tenants who don't even come in for their eviction hearing. That's over half that don't even come in. And what I encourage people to do is not blow off the eviction process, because if you don't come in, you get a judgment against you generally, and that will stick with you. So if you are trying to go ahead and buy a vehicle or buy a home, that will come up. One of the things I want you to be very cognizant of, and I'm very aware of it, is we have a number of people who have mental illness, who are in apartments, people who have disabilities that are in apartment units. And for whatever reason, the family has placed them there, or they're capable of being self-sustained in some capacity. But when it comes to the legal process and the eviction process, I have great concern about those individuals being able to comprehend what is now taped on their door, something that they have to address and look afterwards. So I have great concerns about that. Most of the renters in New Orleans are month to month. We have about 7,600 landlords in the New Orleans area. Most of those are mom and pops, and not really the big landlord apartment complexes. But we've been doing evictions, and evictions are taking place. I would probably say one of the most egregious cases happened back on August the 21st, when a young lady was, her last name is Major. She is accused of setting fire to an apartment complex at 1629 Washington Avenue. And she was charged with 26 counts of arson. She was in here on that day. She was given 24 hours to evict her apartment unit. She is accused of going home and using an accelerant. and starting a fire at that unit, and subsequently displaced 26 other units. That's a very egregious case. So, you know, this is a crisis that we must address. However, evictions are down in my office simply because of the moratoriums that have been in place. I think people are waiting until the end of the year, until this last CDC policy order expires. I've had one apartment agent who has told me he's got 300 evictions that are waiting to happen. But a lot of these evictions are in neighborhoods with a 80% African American population. So, you know, it is increasingly affecting the minority population in our city. You know, there was some talk about landlords. I can tell you, having spoken with the Landlord Association president, this is a business for them. This is not something that they take lightly. They don't want to evict people. They don't want to have empty units. They want to get some type of payment. Many of them have not gotten payment since probably March or April. So it's really hitting them in pocketbook. I could go on. I'm happy to answer any questions. I will give you some numbers between June 1st and September 21st. We processed 658 evictions, which is down, but it's still a lot. The CC has come up with a declaration page that it is incumbent upon the tenants, and I want you to understand that it's incumbent upon the tenants to have to get this page. It has to be signed. They give it to their landlord, and it says a couple of different things. I've used best efforts to obtain all available government assistance for rent. I either expect to earn no more than $99,000. I'm unable to pay my full rent or make housing payments due to substantial loss of household income. I'm using best efforts to make timely partial payments as opposed to the full payment. If evicted, I would become homeless or need to move into a shelter. I understand that I must still pay the rent at the end, and I further understand that at the temporary halt, my housing provider may require me to pay in full. Now, these landlords know they know they're not going to get any back payment on their rent. If they want to, they have to file a small claim suit, which is something different. They know they're not going to get that back, but they need to have some type of revenue coming in. But it is a huge crisis. We don't want to put people back under the bridge. Children are, you know, at risk as well. Older people, we don't want to make people cohabitate. But what we're doing now is we're giving out that declaration that the CDC mandates to tenants. They have to give that to the landlord. And when the landlord comes in, we're also giving them a one-pager that says that the tenant gave you that declaration or didn't give you the declaration. And in closing, the judge's ruling is absolute. So the 4 judges that are here, they have brand new territory for them, and they have to make those decisions.
Austin, I need you to just be very clear for me, because you got to talk to me in little bitty words. Are evictions allowed or not?
Yes, they are allowed. They are allowed.
And under what circumstances can an eviction happen today?
An eviction can happen for non-payment of rent, as well as some other lease violation. So I'll give you an example. If someone is selling narcotics out of a apartment unit, if someone is firing a weapon, if someone has multiple people living in that unit, that's another lease violation. If they're not paying their rent, the landlord can file a lease eviction. I'm sorry, the landlord can file a eviction filing against them, and the tenant must come in and answer that filing.
And help me with the process. Joe Blow landlord comes in and files for an eviction today. How long does it actually take for that process to work its way through the court?
I would say probably at least 3 weeks. They have to come into my office. They have to file the eviction paperwork. Then they would have to go down to the constable, pay a fee to the constable, the tenant that they are being filed against. And then the tenant can do an answer, and then a hearing date will be set.
And let's just say that the tenant is unsuccessful at the hearing. How long before they're actually evicted?
Well, the judge would make that determination. It could be as little as 24 hours. So for example, in the case of Ms. Major, who was accused of setting that apartment building on fire, she was given 24 hours. In some cases, the judge may ask the tenant, how many days do you need to move out? If the tenant say hypothetically 3 days or 5 days, then the judge will turn to the landlord and say, is that okay?
And how much time does the landlord have to allow to lapse before he or she can file for eviction for non-payment?
It depends on the lease. It's whatever is in the lease. And I don't want to answer for the judge. In a meeting as of yesterday, I was informed that whatever is in the lease is applicable. So
and I'm asking these questions.
I think what you're,
Well, I'm asking the questions to illustrate that the answer to this problem is not evictions. The answer to this problem is helping the tenants or helping the landlords by having funds flow either from the tenant to the landlord or directed to the landlord, because evicting somebody doesn't fix the problem on either side. If you evict a tenant, now you made a family homeless and the landlord is still sitting there with unpaid bills. So at the end of the day, eviction should be the absolute last recourse. We need to be looking at how to make sure that we can keep people in houses as opposed to kicking them out. Now, I got no problem with, again, you got a responsibility and you all have to do what you have to do as a court. But I want to emphasize the fact that all of our efforts ought to be on trying to figure out a methodology so that we can avoid people ever having to come to you other than to say, hey man, how you doing? That ought to be the only reason that people come to First City Court instead of having to come to be evicted.
Correct. Councilman, you're right on the money there, but what I would suggest is that money would flow directly to the landlord. We don't want to go through the middleman and have the money go through the tenant, hoping that it gets to the landlord. And there has to be some kind of effort on the back end that the landlord will not still evict because it's not payment in full.
Well, I'm going to tell you, I mean, unless it's a really, I don't know of very many landlords that want to evict paying tenants. Now, if you've got problematic tenants that are doing stuff they shouldn't do, then yeah, you want to get rid of them because they're a problem, but not a problem because of the payment. This issue now is related to payment. Now, folks that destroy your property or do illegal activities or otherwise bringing down your property or your neighborhood, that's different. But I'm talking specifically about the economics of this related to people who have lost their jobs or the ability to work due to this virus. And I don't think that most landlords would want to evict a good tenant just because they haven't been able to pay. They would want to do what they could do to keep them in place so that they don't run into a tenant down the road that will not do the responsible thing as a tenant. So no, I get it. And the idea of having the money go straight to the landlord, I am 100% in support of that. We don't need to make a bad situation worse by having somebody who is unfortunately unable to pay the rent, who gets a subsidy and uses that for something else, because now you got two problems. You haven't paid the rent and you haven't done what you should have done with those resources given to you to pay the rent. So you've turned one problem into two. I think that the money ought to go directly to the landlords to make sure that the tenant is protected and that the landlord has the revenue that he or she needs to be able to service their responsibilities. So we're there. Any questions from my colleagues?
Yeah, I would also recommend that. Is there a system, if it does go directly to the landlords, to make sure that the tenants are aware of that too, in order to protect the tenants? You see what I'm saying? Like the tenants also need to be aware. Like you don't want money just to go to a landlord without the tenant knowing, right? And for a long period, and for a period of time, right? Because the tenant needs to know that it's being paid for, and that, you know, we don't want a bad situation to happen. They get kicked out even though the landlord's making money. You see what I'm saying?
Well, there is a problem with that. And the problem with that is the bill still stays with the tenant. So in essence, you got to come up with like a foolproof system, because what you'll be doing is you'll be basically telling the tenant you're not responsible for your bill if you just give the landlord the money that the tenant owes. So what you got to come up with something to catch that. Now, you know, you may never thought of this, but there's some people out there who are milking the system. We have people who have not had a work stoppage, people who are still making money, still people who have gotten raises, and they decided that, well, I didn't have to pay my rent, so I'm not paying it. And, you know, they just pocket in the money. So that's a huge problem.
All right, any other questions from my colleagues? All right, do we have public comment? Please, public comment.
Andronika Morris, representing the Greater New Orleans Housing Alliance. The CDC eviction moratorium makes it clear that no one should be without housing during this pandemic. Unfortunately, the moratorium has left several loopholes and fails to address people who are already evicted. As it is now, the current CDC eviction moratorium alone will leave thousands without protection or force them to exaggerate their vulnerabilities. The courts refusing to hear evictions until October 4th was also an extraordinary move, but with so many evictions happening outside the court system, we need to increase outreach, education, and provide more support to our legal aid organizations, SLLS and LAFHAC. We should not be forcing residents to stand their ground against landlords in time of crisis. We need a strategy that puts housing first and recognizes that housing is essential if we are to survive this crisis. And that's the only comment on this item.
Thank you. Colleagues, any other comments or questions? Well, with that, again, I want to thank you, Mr. Clerk, for providing us the information. And I want everybody to be clear that we have to come to an amicable solution that allows for landlords to sustain themselves and that we don't create problems by evicting folks that are going to end up homeless. We've got to be able to thread this needle. So we got to keep working towards getting to that end. And I appreciate all of the participants today. And if there's no further business, I'm sorry, we got one. Go ahead. You can't hear you with the mask. Absolutely. Can I get a motion before we adjourn to approve the minutes from the last meeting?
So moved.
Second. All in favor, say aye.
Aye.
Aye. Okay. Any opposed? All right, so that's done. So with that, folks, I will entertain a motion for adjournment.
So moved.
Second. Anybody don't want to go?
I did.
Okay, well, in that case, looks like we all want to go. So with that, thank you, folks. Please be safe. Wear a mask, save a life. Thank you all. We're adjourned.